at their brand new location, everyone, is Dr. Eric Smith from Georgetown Bariatrics and Advanced Surgical Services. Welcome to the show, buddy.
Thanks for coming to see us.
Okay, loving the new location.
Yeah.
Why did we decide to open up this massive clinic?
You know, we needed it. We're outgrowing ourselves. It's a good problem to have, but you know, our patient volume has just continued to increase. We want to offer more resources for our patients and be as comprehensive as we can be, and the hospital did a great job of giving us this brand new facility.
Okay, well, it's obvious that you thought out every point that a patient needs within this building. Let's walk us through from the very beginning when we walk in.
Yeah, I mean, obviously we've got a very nice, spacious lobby. All our chairs are large to accommodate patients who are overweight, and there's criteria that we have to meet for that. We have all of our people up front to welcome them in, whether they need to take vitals right now in the midst of COVID and temperatures, to make sure that they're safe to proceed and get all the information turned in. And then when we take them back to their rooms, you know, all our doorways are large. We can accommodate patients if they're in wheelchairs. And all our exam rooms are massive compared to what we're used to before, with marker boards in the rooms to telestrate things and talk to patients about procedures and draw things out. And everything that they would need. And
I just want to touch on that, because when you say the bigger chairs and the bigger doorways, I personally have to say that I thought about that when I was sitting out there, because we've done a lot of these type of interviews.
Sure.
And allowing a patient to feel comfortable.
Yeah, absolutely.
And not squeezing into a chair, because it makes them feel insecure.
Yeah, absolutely. We want everybody to feel comfortable. And even the patients that we see that are here for something outside of surgical weight loss, they talk about how much they enjoy the size of the chairs and the doorways and how spacious everything is.
All right, well, I want to jump into some of the offices, because you've also got a few other things that I want to talk about.
Sure.
So we're all under one roof now, our insurance offices.
Yes, well, everything's here. So our dietitians are here, our insurance coordinators are here, but what we've also done is we've brought in some of the ancillary services too. So all our lab work is drawn here. They don't have to go over to the hospital. Our IV therapy is done here. If we have somebody that's a little dehydrated, we bring them in, put them in a nice comfy chair, let them watch TV, and give them fluids and get them back on their way. We don't want them having to come into an emergency department to get fluids or go somewhere else. And so we offer that for patients as well.
Why is it important to be able to have all of these things under one roof?
We don't want them to have to travel places to do that.
Yeah.
And I think we've learned a lot in the midst of COVID, that we don't want to put people around sick people. So if we can pull things out of the hospital the best that we can and keep them in a nice, controlled environment, it's better for the patients and it's more convenient.
Now, we've just covered the insurance and some of the other rooms. I do want to talk about the dietitians and your kitchen as well.
Yes.
What was the purpose of combining those two together as well?
Well, we wanted to have a full kitchen, and obviously it's nice for the employees to have that for their breaks, but we wanted to have a full kitchen so we can do cooking classes with our patients. When we have support groups and things, we can incorporate cooking in those classes and maybe make that a little feature. Show them easy ways to do things that are timely, cost-effective, and let them participate in that as well. It just furthers our education that we give our patients. I
do want to ask you something, because I'm a firm believer in IV therapy. I love it. Is this something that you're going to be opening up to the public, or is it just for Georgetown Bariatric clients?
So right now it's for patients that have had surgery or are surgical patients. Right. That is definitely something that we're looking at and talking about to expand that, especially with our medical weight loss program that we offer as well. And hopefully that's something that we'll be talking about in the future.
All right, well, we've got much more to cover. Stick with us, will you?
Okay.
If you want to find out more information, there it all is up on the screen, everyone. Georgetown Bariatrics and Advanced Surgical Services. We'll be back after this short break with more with Dr. Eric Smith.